Hi, and welcome to the Revive, Thrive, and Optimize podcast. I'm really excited today because our guest is Stephanie Ramsey, who is a nurse practitioner.
Hey, Billy.
How are you?
I'm doing great today.
Good. So tell us what made you get into nursing. How'd you end up going to nurse practitioner school? You know, where'd all that and how'd that happen?
Well, my mother was a nurse and my aunt was a nurse, and I thought, well, they're helping people and I want to help people. So I started out as a nurse in 99, went back to nurse practitioner school in 2006, and been working as a nurse practitioner since, and finished my doctorate in 5 weeks.
Oh, wow. Okay. I didn't know you were doing that too.
Yep.
So, all right. So your journey sounds a lot like mine. You got into healthcare because you wanted to help people, right?
Correct. Absolutely.
So how's that going in the standard medical community, you think?
Well, at first I thought it was going okay. Then back in, I'd say 2016, I had an administrator walk in and tell me as a nurse practitioner I need to see 30 patients a day. And I'm like, I can't do that and give good quality care. How do you expect me to do that and educate them and tell them everything I need to? And they told me essentially I could have a drink and figure it out. And I was like, okay. So then I left that organization.
Yeah, so part of that is that I've talked about a lot is the insurance system, right? They're making y'all see so many people so fast because they've cut the fees to they'll only pay so much, right? So
Correct.
You got to do volume rather than quality.
You got to do volume. You got to go by their guidelines. You got to do the guidelines that they feel like the experts have set out for us. And sometimes that's not always the best because everybody's an individual patient.
Right. But if you don't practice standard of care, then the insurance yells, the administration yells, everybody's yelling at you.
Yeah, everybody's unhappy. But the patient may be happy with what you're doing.
Right. The patient gets the bad end of the deal when you have to follow guidelines. And that's what I talk a lot about, how if you're dependent on a copay for your health care, to see your health care provider, or to get your hormones, or to get your supplements, you're in real trouble because they're not going to cover anything that's good for you.
Yeah, they're not. They're not going to cover your supplements. You pay for your supplements out of pocket, but they're worth it in the long run.
Right. And so that's where I wanted to go with you, because you've had a lot of success personally and in your family and with friends on different issues, right?
Correct.
So what would you, for yourself, what's the most significant issue that, or think, maybe not issue, but quality that you've noticed from the supplements?
Well, I used to get about 3 to 4 hours sleep a night. Now that I'm on supplements, hormones, I go to bed 10 o'clock and I get up at 6. You don't see me posting anymore at 2, 3 o'clock in the morning on Facebook because I'm bored, because I'm able to sleep now. And with the sleep comes a better quality of life, better able to focus on my patients, better all-around mood, just a happier, more well-rounded person.
Yeah, I remember when we first talked about it that you were talking about how poor your sleep was. And I was like, Stephanie, you got to try to fix that, right? Because you understand how important sleep is.
Yeah, you've got to get your sleep because that's when your body's recovering. And
right.
I was not getting my sleep, but I was not putting good things in my body.
Yeah, and so that's part of it, right? Is the right supplements, the right foods, the right water, the whole 9 yards.
Right.
I mean, and the right hormones was part of what we did for that.
Right.
Because I remember Sean, your husband, telling me that, you know, you'd wake him up wanting to go to the gym at 2 and 3 in the morning. He's like, I'm trying to sleep, woman. Let me sleep.
That is correct. But you know what? He would get up and go with me. But that was not what was best for my body.
Right. And so you went from 3, did you say 3 to 4 hours of sleep?
3 to 4 hours of sleep a night.
To 7 to 8, it sounds like?
Yeah.
Okay.
And I don't wake up in the middle of the night anymore and go get on the couch and go surf Facebook, or, you know, sometimes I was reading medical articles to educate myself, but it's just not a good habit to have because your body needs sleep. And I know better than anybody your body needs sleep. I teach that to my patients. But I wasn't doing it, because I wasn't putting good things in my body.
Yeah. So what was the number one supplement that we used for that? Do you remember?
Well,
I know we did a regimen, so I get it. But
so I think the magnesium was the big one. I mean, that's used in over 300 different mechanisms in your body. So I think that really helped, the magnesium. I mean, I'm taking the whole the whole supplement regimen.
Right.
But I also take the L-theanine, which kind of helps calm my mind at night.
Yes. Stops the mind chatter.
Yes. It completely stops the mind chatter, and I can just relax and drift off to sleep in my cool room.
Tell me, I don't remember everything that you're on at this point. Are you taking the melatonin at all?
I do not take the melatonin.
I didn't think so. So we really did it without even using the, quote, sleep hormone, right?
That is correct.
But speaking of hormones, I know that you're using bioidentical micronized progesterone.
Yes, that is correct.
And that improved it even further when we added that.
Absolutely.
Element.
I think with the combination of it all, we found what worked best for me. It was individualized for me. It wasn't, here, take this prescription of Ativan that's going to have you out, driving around in the middle of the night. It was, what can we do for my body that's best and the safest for me? And that's what worked.
And I think you said a really important word there, Stephanie, that I try to teach people all the time. Individualized.
Absolutely.
It's not a standard of care that we are talking about here. We found what works for Stephanie. Now, what works for Stephanie will work for a large majority of people, but we may have to tweak it for Sally or Jane or Mike or Billy, right?
Right.
We may have to do something different for them.
And that's part of the being able to spend individualized time with your patient, not pushing them through one door and through the next and into the room. Sorry, didn't mean that.
Not trying to see 30 in a day.
Right. Yeah, no. I'm trying. We sit down. We looked at what was best for me, where I was deficient. Looked at my labs, and that's the best thing that we could come up with, and it worked.
Yeah, and that's the beauty of it, is we find that usually with maybe not everything right the first time, but within a reasonable amount of time, we can tweak things and get results for people for a variety of conditions.
Right.
And so sleep is a big one because everybody's busy, everybody's stressed. I get it, but we need to find ways to overcome that.
Yep.
And so you've done that.
Yeah.
So.
One of my colleagues said to me the other day, she's like, "You hadn't been posting any 2 a.m." I said, "That's because I've told you what I'm doing, and it's working, and I'm happy, and I'm going to keep doing it."
Yeah. So what else have you noticed from the supplements personally? Sleep obviously is a big thing.
Energy.
Okay.
Energy, big energy. Like I said, I'm working on my doctorate, so energy is really important. It's been important for the last 2 years. Energy, mood, just overall feel better, changed a lot to do the right things, eat the right foods, drink the right water, put water in your body, and just making sure that, I take my supplements. I've got, my digestive enzyme on my desk for lunch at work.
Right.
I'm doing what I need to do to make myself better.
Well, and Stephanie, you said something really important. I want the people to understand that you talked about the water, the supplements. Now, you're a person who's willing to invest in your health. You and your husband, you have purchased recently a Kangen unit for your home. Mm-hmm. You've been buying supplements and hormones for quite some time now. So, and you said something earlier about how it would pay for itself or pay off.
Yeah, absolutely. Either you're gonna pay now or you're gonna pay later.
Right.
Because you can't not give your body what it needs. You can't not give your body what it needs and then expect for it to be healthy later on. You've got to treat your body good now, and that's everybody. And if you've got a problem, you've got to recognize that problem so that it doesn't trickle down and cause additional problems. So by treating myself with the supplements now, I'm preventing problems later on. In my mind, that's what.
No, I love that, and I think you're dead on. I tell people you'll do maintenance on your cars, your boats, your motorcycles, but you won't do it on yourself. I mean, it's crazy.
When people tell me I don't have time for that, and I'm like, well, do you have time to be dead? Yeah. Because that's where you're headed. If you don't,
dead, sick, or in the hospital, right?
Yeah. If you don't have time for it, and that was what I realized with myself. I had to make time for myself to do these things because you can't go off 3 to 4 hours of sleep a night. I knew that. That's why I said, hey, called my outpatient clinical pharmacist and said, I need help. Can you help me?
Yeah.
Because I had been to my doctor that I trusted, and I said, I need help. And we'll take this. Well, that's going to sedate me. That's going to constipate me. That's not what I want. Can we look at some additional labs maybe? And he was like, oh, it's just part of aging. Okay, I know I'm almost 50. Will be 50 this year. But that's not just part of aging.
No.
There's something else going on in my body. Help me figure it out.
But Stephanie, as you know, being a trained healthcare provider, that's not what they're taught. They're taught that you're deficient in lorazepam, Ambien, Xanax, diazepam, whatever, right? It's not got anything to do with your progesterone levels, your magnesium levels, your L-theanine levels, your melatonin levels. They don't even know. I don't even know if they know what that is or care.
Or are they willing to dig into it? I mean, it takes research, and it's taken me research to unlearn what I've spent years learning.
Yeah.
And now I'm having to unlearn. And then I say to my colleagues, and I've got other colleagues now, they'll come to me and ask me questions. Well, what do you think about this? I mean, me and you have been texting back and forth about another colleague that's, we're looking at some of our patients who are like, I don't want to be on this. How can I get off this? And we're looking at additional things that we can help them through our outpatient clinical pharmacist. That's what I'm going to call you from now on. Yeah, you know that guy.
So we do text and talk back and forth a lot about a lot of different health topics. When I think about it, what is one of the things that I talked about a lot, you and I have discussed a lot, is insulin and how it's never tested, even though I say it's the most important blood marker anybody can ever have.
I 100% agree.
What's the highest number that you've seen? Because you've sent me some pretty crazy results from some folks.
I seen a really high, crazy number in the 300s, which I don't know how that one was possible.
Right.
But that was one somebody brought to me. I've had one from a 24-year-old girl who she was like, I had told her, you need to get, this is a friend, not a patient, but a friend. And I said, you really need to get them to check your insulin level. I'm concerned some of the things you have going on are related to, insulin resistance. And she said, well, my doctor checked my A1C, and she said it was 4.8, so I didn't need an insulin level. I said, well, she's wrong. Mm-hmm. I said, tell her you'll pay for it. And she did, and we checked it, and it was 36, which it shouldn't be. Shouldn't be any greater than 5. She's 24 years old.
Yeah.
So she's got a problem already, so we've got to work on getting that problem taken care of before she winds up with diabetes. But I'm looking at, okay, she's thinking in the next 5 years she wants to get pregnant. She's not going to be able to get pregnant because she's not going to ovulate, because she's not going to have that estrogen surge because of that insulin blocking that. Yep. And that being so high. So, let's see what we can do now to work on that. But we're not talking about that in healthcare either.
No. And so she's 24. Mm-hmm. She wants to have children. I'm going to make the assumption, and you can certainly correct me if I'm wrong, with an insulin of 36 that she's carrying some extra fat around. Am I right?
You're correct.
Okay. So it's amazing to me that a medical professional can't see this lady and go, she's carrying too much insulin. I mean, I don't even think you have to have the test to look at her and tell, right?
Right. Oh, I agree, but I just wanted her to understand.
Absolutely.
Yeah.
Absolutely.
Because, sometimes when you're saying something that's contrary, when you've bought into the functional medicine, you've read the research, you understand how important all these things are, and then you've got somebody who's an MD. I'm a nurse practitioner.
Right.
You've got an MD telling her you don't need that test. She doesn't know what she's talking about. And I'm saying, yeah, you do. And she's telling her, well, you're fine because your A1C is 4.8. And I'm saying, no, you're not.
Right.
So, it's you gotta look at that. And so that was why. But now, got her doing some things, making some changes. So because she sees, that number is way higher than it should be. My A1C is not as important as I thought it was. My insulin level is what's important.
Exactly. And that's the point. We miss the whole picture if we only look at A1C. I tell, or even worse, just fasting glucose, right? So
that would be horrible. Yeah. That's all you looked at.
But see, Dr. Robert Kraft did all these insulin studies on people, and he says that we misdiagnosing somebody like your friend by 10 to 15 years of having diabetes because we're not really checking the most important number.
Part of it. You're correct. Yeah.
Okay. So you agree then that the insulin number, although it's almost never done, is a really important marker,
Oh,
right?
Absolutely important. I've recently had another friend. I told him, I said, he was in his 50s, and I said, you need your insulin level checked. And he went to the doctor, and she was like, well, they said that my insurance won't pay for it. And he said, well, I told him, a friend of mine told me I need to have it, so draw it anyways. Now, his was good. His was good.
And it's not expensive, Stephanie.
No, it's like $15.
Yeah, I was going to say. It's like $20 or so.
Yeah.
So it's not expensive. And actually did a consult with a young lady from the Middle East today. I can't even remember exactly where. I just knew it was Middle East when she told me. And she has hyperinsulinemia. I'm 99.9% sure after going through everything with her. And when I explained to her that she was drowning in insulin and they're giving her drugs to increase her insulin and they're giving her insulin shots to increase her insulin level, she goes, that makes so much sense to me, but nobody's ever explained it to me that way. Oh. And so I do think that's the driving factor behind all maybe not all, the vast majority of overweight and obesity, the heart disease, the cancers, the strokes, the blood clots, all the Alzheimer's, the things that we see, or you see a ton of in doing what you do. Yeah, and the infertility, by the way.
Yeah. Well, and aren't they they're calling now Alzheimer's like type 3 diabetes? Type
3 diabetes in the brain. I probably have literally been teaching that for 20 years or more. Yeah. So it's becoming
a lot of us are behind, but we're catching up.
I'm just saying it's becoming a mainstream term that we hear now.
Because we're
but it's
seeing
insulin resistance in the brain.
Right.
That's essentially what it is. It's hyperinsulinemia in the brain. So that's a great point. So we talked a little bit about some of your patients, but how about your husband, Sean? Tell us about his journey with the supplements.
He's had some problems with some broken bones because of some other meds that he's had to be on for a chronic condition. And, we reached out to you and said, hey, Billy, what can we do? Because, one of his meds was breaking down his bones. And, the doctors were just like, well, that's just part of it. Okay. And we're like, well, we need help. So I called you, got him on you're going to have to, I grab it off the shelf.
Bone Mineral Pro. Yeah. Bone Mineral Pro.
The Bone Mineral Pro. And, he was having some loose teeth, okay, and, had broken a bone in his back. So it was just broken some ribs. So we called you, got on the Bone Mineral Pro, and since that time, he's been on it, takes it every day, morning and night, grabs his little packets out, and he's not had any more of those problems. He's got it. We've got pharmaceutical meds that people have to stay on for some chronic conditions. That's how it is.
Sure.
But there's supplements that we can pair with them that can help people with some of the side effects if it's something they have to be on. And that's the positive thing with that. He's also on the regimen too. We're all on
that's not always you.
Yeah,
but that's
that was the one that's made in my opinion, the biggest difference for him.
And you were saying that his loose teeth from the jaw have subsided. They tightened back.
Tightened up. He says he can tell if he did. Because he travels a lot, so sometimes he's out of town, and if I have to ship him, he says he feels like he can tell if he's been out.
Yeah.
So, that's our personal experience together. I can't tell if he's got loose teeth or not.
Yeah, no, I hear you. But the good news is that situation has improved for him. Just by using some supplements.
Yeah, absolutely. The supplements that we know that have good quality, because I know you've probably read more of the research than I have. But and that's what I tell my patients when they come in. You got to make sure you're getting good quality supplements, because there's studies out there that show the supplements you get from some of these big chain stores, there's not good quality supplements in there, and they could be doing more damage than good.
Absolutely.
Or no good at all, so you might as well just hand somebody $15 and just walk away from it, because that's essentially what you got, nothing.
And I use that analogy a lot. I say you can buy that stuff, but you might as well take your $20 and flush it down the toilet. Yeah. It's the same difference, right? I mean, it's worthless. So I love that.
And the research has showed that.
Yeah.
When you're looking at it. So
yeah, for sure. So so you and Sean have had really good results. How about and you've talked about some friends. What's the next thing you can think of with your family or friends?
I've got a daughter who lives in the UK.
Yeah.
I buy her supplements and we ship them over there because she can't get the good quality supplements over there. She has ADHD. She's working on her PhD over in Wales and Bangor University. And she ran out, I was a bad mom, let her run out of her L-theanine that she takes for ADHD.
Yeah.
And she's like, Mom, you got to get my medicine shipped. It's not her supplements what it is, but she says she can tell a difference, can't focus as well, just as anxious if she's not on it. So it's worked really well for her. She's also on she's on the vitamin D, because remember when she come home, we checked her vitamin D. She was taking a vitamin D supplement from over there in the UK, and her vitamin D was 5.
It was one of the lowest I'd ever seen.
Yeah, it was really low. I think it was 5.
Yeah.
So we got her on the supplement. She was on the supplement, the vitamin D with the K2.
Yeah, with Super K.
With Super K,
Yep.
right.
Right.
She was on that for, I think, 3 months. We rechecked it, and it was up to like 26, which was great. And I'm sure it's higher now, but she says, that's really helped her mood as well, because you know how many mechanisms vitamin D is used in the body as well.
Right.
So we've got her on the 4 plus the L-theanine plus the vitamin D. Now her husband is on the melatonin for sleep. Remember, we had a problem with that.
I was going to say, we couldn't send it though, right?
Well, that got confiscated. Remember, because it was outlawed or something. I don't know when it got to customs. So when they come home in January, remember, for the reception, we stocked him up, and then I'm going back in September, so I got to buy another stock.
Yeah, so you can take it in with you. You can't ship it in.
You can't ship it in for some reason. I don't know why the melatonin's banned.
Yeah, I don't know United Kingdom rules, but it's weird that a natural hormone that we all make is banned apparently there.
In customs, so.
In customs, you can travel with it, but you can't ship it there. But anyway, you found out ways to get it where he can keep a supply.
Yeah, so they're on, her and her husband are on the supplements in the United Kingdom too, because you can't get the good stuff there.
Right.
So, I've had some friends who were having women can have chronic bacterial problems, bacterial vaginosis, which is just an infection where you get overgrowth of bacteria in the vagina. Mm-hmm. And so I originally sent some people to a vulvodyniologist, a specialist in Charlotte, and she was putting people on probiotics. And I'm like, okay, she's putting people on probiotics. I can direct them to Billy to put them on the probiotic from Billy. And I've directed them here. They've got the probiotic. Problem's gone.
Yeah, so. I tell women all the time that all their urinary tract infections and those type of things, it's just too little probiotic. It's not hard to fix.
Right. Yeah.
So that's good. So you've seen that result too.
Yeah.
And we didn't even talk about this, but our son is married to your daughter.
That is correct.
So when I say our, I mean me and Beth, my wife's son, is married to you and Sean's daughter, Mackenzie.
Mackenzie.
Now, they are pretty committed, I'll use the word committed, to their supplements, to their Kangen water machine they have in their home, to their regimen.
Correct.
What is some, I can talk about Ethan's story, but what's your story? What's Mackenzie's story to you? What has she noticed?
Well, Mackenzie has epilepsy. I'm not going to get upset about that.
Right.
But she had meningitis when she was a child.
Right.
So she had epilepsy, started when she was 17, so I think the supplement she started, I couldn't get her to on my own, but I think with the help of Ethan, got her on the supplements. And, she's done better energy-wise, feeling better. We're hoping, help with just overall with no seizure activity, which is what we want to continue to want. And, I think she's more trying to get away from synthetic hormones, more natural hormones as well. And I feel like she's having positive results from that, from, our minimal conversations about it. But yeah. I try not to pry too much in her business, but I stay on her pretty good. But at first she was, she was like, oh, I think the probiotics bothering me and stuff. And then now she's like, it's not bothering me at all. Yeah. It's doing good for me. And she's having good positive results as well.
Yeah. And I know, they come to the house, a couple times a week at least. And we see them and talk to them. And she's definitely indicated that she feels better and
feels better, energy level better.
I think she's dropped some fat, which made her happy. Of course.
Oh yeah,
she's not going to complain about that. And most people won't complain about that.
Yeah, no, she's not complaining about that. She's getting in shape for the beach trip. So, yeah. So and she's working hard. I think they're working hard together because they've seen the impact of the difference that it can make. For them.
And that's what's exciting to me for a couple that age. They're young. Ethan's 20?
He's 22.
23.
Oh, he just turned 23.
He just turned 23.
Kenzie turns 24 in 2 weeks.
Yeah, so they're a young 23-year-old couple who are committed I know they make up the little
packets,
supplement packets, like for morning, lunch, supper, bedtime.
And I will say, when Ethan was out of town, she was like, Ethan made my packets for me. Yeah, so that way she does it, because she'll tell me, I don't know what all I take.
Right. Yeah, well, that's my point. They're committed to it. Yeah. They're committed to doing what each other needs to make it work. They, like I say, they have their own Kangen unit in their home. So they are really setting themselves up, I think, for long-term success. Like you said, if we don't do it now,
you pay for it later.
And if they want to have children, and I think they do, they need to be healthy and ready to
and taking supplements that are going to be there. Quality supplements, so that when she gets pregnant,
we're going to try to prevent everything that could happen from that's not good from happening that we can.
Because if you put I think in America we've gotten a habit of putting so many bad things in our body because that's what's been given to us.
Yep.
I mean, now we're learning to make the right choices with the right water, the right food, not putting bad food in our body. But the companies that supply it have made that pretty hard, because all the hormones they put in it, all the sugar that they put in.
Yep.
I mean, you can't.
Seed oils, don't forget seed oils.
Seed oils. Yeah. I mean, but you go to the store, and if you want to buy a pack of taco seasoning mix, turn around and look at the packet of it.
Yep.
Every single one of them, taco seasoning mix, contains sugar. It might not say sugar, but it'll say maltodextrin
or dextrose or one of those.
It's in there, and we're not teaching that. And now I'm teaching it to people.
Right.
Turn around, look at the packet, look and see. But they've polluted us for so long that, and sugar 10 times more addictive than cocaine.
Yep.
So if sugar's 10 times more addictive to cocaine, how do we get people to buy more of our product? Let's put some more sugar in it. Do we need sugar in taco seasoning mix? No, because you can take that. You can make that with 7 seasonings out of your pantry.
I was going to say, what we do at our house is we make our own.
Right.
We make our own seasonings. We make our own salad dressings. Typically, we make our own, like tartar sauce or those kind of things if we're going to have them. Remoulade.
Right.
Because you're right. You cannot outside. And I will give the people listening a little tip. If they need like salad dressings, they don't want to make them, or ketchup or mustard, barbecue sauce, Primal Kitchen. Primal Kitchen,
exactly.
It's a brand that you can feel good about, with no sugar and avocado oil or organic avocado oil or organic olive oil, and not, canola or soybean, which is what we find or cottonseed in just about all this stuff.
Yeah.
So that's a really interesting point. But I find it very encouraging when I have people their age. Now, granted, Mackenzie grew up in your house and Ethan grew up in our house, and so he didn't ever have any choice. He used supplements from day one. He had no choice.
Yeah.
But as a competitive gymnast growing up, he really needed that. And I'm gonna tell you, we were probably maybe the only set of parents at a gym with hundreds of kids. And he was full time. I mean, he was homeschooled and going 40 hours a week. It was like a job for him to train.
Right.
He was a level 10. And we took his lunch every day.
Yeah.
We took him lunch every day because we didn't want him eating the McDonald's and the Bojangles and the, whatever all those other kids were eating. But I remember many times when that gym would have, I'll call it the outbreak of the stomach virus.
Mm-hmm.
I can never remember a time where he ever got it or missed a day. He's probiotics, taking all the other supplements, of course, but vitamin D, probiotics, when I think about those stomach virus things.
Well, Mackenzie teaching now.
Yes.
She, that couple, I guess about a month ago when she was getting sick and she felt like she was getting sick, and she called you and you gave her a concoction. I don't know what it was. She said, Billy gave me a lot of stuff to take. And she said she felt better. And I was like, okay.
Yeah.
So,
it's amazing what our bodies can do when we just give it what it needs. I mean, it's really, I tell people what I do is not that complicated. It's just that I've gone through and learned it just like you have, and you can experience it and have other people experience it and go, oh, well, let's do that for everybody that'll listen.
I think people got such in the habit of walking in the door and the doctor handing them an antibiotic and they thinking that's what's right. And it's not what's right, because, if an antibiotic's needed, it's needed.
Absolutely.
If there's
it can save your life.
Yeah, it can save your life. But if it's not needed, let's do what is needed.
Yeah.
And sometimes that's probiotics. Sometimes, that's just symptom management. Sometimes if you've just got a cold going on, you can manage the symptoms. You can if you've got a stuffy nose, some normal saline up the nose,
Yep.
some things that
Yep.
you don't have to have, an antibiotic to take care of. I think we've got in the habit of that. And then people don't understand, and every time you take an antibiotic, what you're doing to your gut microbiome.
That's correct. You permanently change it for the negative.
Yeah.
And again, that doesn't mean you should never use an antibiotic. It means you should use them when you need them only, and not just for every little, like you say, cold, sniffle. I mean, all these kids getting prescribed amoxicillin and Augmentin for these ear infections, they're viral, and it's a complete waste of time, but it satisfies the mom. It gets them out of the office. Everybody's happy until the kid has a resistant infection, and then they don't know what to do because they've used up all the antibiotics they can. And I don't remember the number. I think it's 36,000 people a year, I believe, die from antibiotic resistance. Don't quote me on that number, folks, but there's
there is a number.
Tens of thousands of people die because the antibiotics won't work because they've become resistant.
Well, and that is one thing I'll say the medical community is trying to push for is good antibiotic stewardship, because we don't have that now, and we've recognized it as a problem. And they've talked about, by 2050, we're not going to have something to treat strep because we're using antibiotics like we shouldn't be using them. So there's a proper place for antibiotics. Yes, there is. But it's not, I've had a cough for 2 days now, and I've got a sinus infection because I got a little bit of pressure.
I need a Z-Pack. That's what I hear all the time. I need a Z-Pack.
And you know what's funny? Z-Pack, it doesn't even cover the bacteria that causes the sinus infection.
That's what they think.
I know.
That's what they've heard.
Because somebody gave it to them because they didn't pay it. They didn't use good antibiotic stewardship.
Right. And Stephanie, the scary part is, though, you're saying the medical community is trying to do better with that, which is good. I'm glad we're doing better with that. But 70% of the antibiotics produced in the world are actually used, and you said it earlier, in the food we eat.
Yeah.
It's given to the cows, it's given to the chickens, it's given to the pigs. So people say, well, I don't take antibiotics. I'm like, well, do you eat store-bought meat or out to eat meat? Because if you do, you're taking antibiotics. You just don't realize it. You're not directly taking them. So it really affects us because, as you know, 70 to 80% of our immune system's in the gut. 2 of my 4 foundations are all about the gut, right? The probiotics and the enzymes. Because if our gut's messed up, it's hard to avoid everything coming and going, right? The colds, the viruses, the flus, the coughs. It's all going to hit us much more likely, frequently, if we don't have good gut health.
That's why I tell people: if you take a probiotic, you can keep a lot of stuff at bay. Keep it away. You can be healthy. People around you can get sick, and you not get sick.
Yeah, that's what I tell people.
And that's not always, but
it's not 100%, but it definitely increases our risk of not picking up all those things for sure.
Correct.
I had a lady today that come in and she pointed to her hand and she had this big rash just on one palm of her hand. And she said, my girlfriend has been telling me I have to come see you. And she said, I've tried dermatologists, I've tried primary care, I've tried everything. They've given me creams, they've given me steroids, and nothing works. It hurts, it burns, it hurts. And I said, we need to fix your gut. And she just kind of looked at me and I said, do you have gut issues? She said, yeah, I have heartburn and stuff. I said,
and probably on omeprazole.
We won't even think we got into that.
We won't even go that. We won't go that far. But
I need you to do the foundational 4, which 2 of them are for your gut, and I need you to do vitamin D with Super K. And she did. And I suspect that was just today, but I suspect within a couple of weeks she'll see that rash significantly improve.
Yeah.
And the burning improve.
Well, that's like Dr. Casey Meem. She's talked about, she was with, conventional medicine for so long, and she was like, I was treating all these itises, which is just infection.
Inflammation.
Just inflammation, I was just treating all these itises, and really I need to figure out what's causing them.
Yes.
And that's part of it. You got to figure out what's causing it, and it's not, just treat it with you don't want to treat it with just a steroid. You don't want to treat it with antibiotic. You want to figure out what the cause is, and I think that's what we're doing when we're looking at the supplements. We're treating what's the cause and getting the right food and getting everything in the body balanced correctly.
No, I love that. And you're right. We're trying to get to the root cause of the problem and let the body correct itself.
Yeah.
And that's really in a big 10,000-foot view, what I'm trying to teach people to do is let's take away the junk, give the body what it needs in good quality, and let's see what it can do, because the body is pretty amazing. God designed our bodies to be pretty amazing.
Absolutely. If we just give him, if we'll get out of the way.
Yes, we get in the way a lot.
We'll get out of the way.
So you've had some really good experiences as a healthcare provider with using the natural supplements for you, your husband, your children, your friends. What would be the number 1 or 2 or 3 pieces of advice you want to leave everybody with tonight that you think could help them experience better optimal health, right?
Optimal health. Stay away from sugar.
Yes.
I mean, that's you got to get away from sugar, and you got to put good things in your body. Good quality things. To me, that's putting good quality supplements. I mean, I really firmly believe in it. I tell everybody at work, that's to me, that's the number one thing. Putting good quality thing in your body. Sugar's not good quality. It's going to cause you problems. It's going to cause you to have insulin resistance. It's going to cause you to have inflammation. And then after you get rid of the sugar, put good things in your body. Your probiotics, you got to have those. I mean, I feel like you got to have your probiotics. You got to have your magnesium because it's used in so many components of your body. I mean, it's just I can't stress enough. You got to put good quality things in, good quality food too.
Yeah, absolutely. So the first 2 pillars: God-given quality foods, the world's best nutritional supplements.
Yeah.
I mean, that's kind of where you and God-given quality foods would not contain a lot of sugar.
No.
Certainly not added sugar or unnatural sugars. And then, the OptiU Foundational 4, the vitamin D. I mean, that's perfect. Yeah. I think that's perfect advice.
Yeah. Be responsible for yourself. Yeah.
Be the CEO of your own health.
Don't rely on your doctor because he's got to see 30 patients in 8 hours a day.
Yeah. Yeah, get out of the insurance system and find a doctor who takes cash. That's what I try. Or it doesn't have to be a doctor, nurse practitioner or physician's assistant. And I'll be honest with you, Stephanie, in my personal experience, I have much more success, and so do the people that I do all these consultations with, working with a nurse practitioner or physician's assistant. Because they're more open-minded in my experience than the medical doctor. Well,
I think a lot of us now are just realizing, through continual learning, what we need to be doing for our patients, spending more quality time with them, looking at them all over as a holistic rather than this standard, that standard, this next standard, because all the pieces fit. You're one person. You're not the cardiologist here, the endocrinologist here.
That's right.
You're one whole person, and we need to be looking at that.
Yep. Well, I love it. So take away the sugar and eat and take the right supplements.
Right.
Take the quality supplements.
Yep.
I love it. Thank you so much, Stephanie, for taking time out of your busy schedule. All right.
All right. Thanks.